morning, listeners. Good morning. It's Friday, and today is our special edition. Twice a month, we do something called Evolving the Species. It's a roundtable discussion. I have two co-hosts, Dean Lloyd of Accutone.com. Sorry, Dean. Am Rosen, LifeGame.com. And to learn more about them, they're with me for every one of these roundtables. You can either go to their websites or you can go to www.Dr. Hurley, click on About, and go down to Roundtable, and you will get their full biography, some information about them. I do encourage you to visit their websites. They're the ones that actually conceived of doing this particular program, and it's, what we're attempting to do is actually bring incredible practitioners and researchers and scientists and other people on and kind of blending it through through AM's expertise with what's called the X factor, or how do we begin to work with consciousness around the issues we're discussing. And today's guest is going to share her research into a subject that is extraordinarily provocative because of the way it's been manipulated by the factions of social engineering and mainstream agendas. So I'm going to ask you to, if you have an emotional response to the topic, just relax. We're actually here to share some very interesting and very necessary research and news. We're not here to discuss the controversy, what is now known and understood, but what is now known and understood about the complex interactions of life and the web of life among human beings. Vicki Thorne is our guest, and she's the founder of Project Rachel and the executive director of the National Office of Post-Abortion Reconciliation and Healing in Milwaukee, Wisconsin. Her work has led to research on how people fall in love, how they bond to each other, and she explains how her findings, especially those related to hormones, affect human behavior and relationships. She's a trauma counselor, a spiritual director, and a prenatal loss and bereavement facilitator. When Vicki Thorne founded Project Rachel in Milwaukee in 1984, she was inspired by a self-destructive friend who had given one child up for adoption and aborted another. Her friend said, "I can live with the adoption, I can't live with the abortion." So Thorne soon became an expert in a field that didn't exist, she explains. And today she's actually catalyzed. There's now 140 U.S. dioceses that have started this post-abortion healing ministry, and it's spreading around the world. Good morning, Dean. Good morning, Am. Good morning, Vicki.
Good morning. Good morning. The chorus of voices.
Yes, I know.
Lorraine and Vicki and Dean, and to all of our fellow travelers through this journey of life.
Well, I want to say especially good morning to Vicki. How are you, Vicki?
I'm wide awake and here and ready to go. I thank you so much for this opportunity to talk about this subject.
I thank you for being willing to come on and talk about the topic. And, Dean, I'm just, listeners, what we do is you'll get to understand. I just have to mention, guys, Dean and Am have actually taken these roundtables. You can get the archives on my website or through GCN, but they are putting them up on YouTube commercial free. So thank you for that. So if you really want to hear, so this will be available afterwards on YouTube, and the first two roundtables we did are also on YouTube. But as usual, guys, we don't have a lot of time, so I'm going to turn this over to Dean, who's going to be asking the right questions, and we'll go from here.
Good morning, Vicki.
Vicki?
Am I on? Hello?
I'm here, but you broke up on me, so.
I'm so sorry. It's sometimes the phone line out here. I live in the mountains, and we occasionally will have the weather come through here and crack things up a little bit.
Okay.
But we're good.
Well, you're back now, so.
So, Vicki, I want to know about you. Tell me a little bit. Give me the reason why you got into this topic.
Why did I get into it? Well, it really was, as Lorraine said, that experience of my friend in high school. She was a year younger than I was. We went to a day school, boarding school. She was a boarder. I was a day student. And the year between her sophomore and junior year, she had this abortion arranged by her mom. And, after that, she just talked to me about the pain and the mess of her life in many respects. And she always said, I can live with the adoption. I can't live with the abortion. So she was young when she placed this child for adoption. I would guess 13 or 14. Now, her brother was the father of the second baby. I think that's the reason her mother sent her to the boarding school, though her mother had also attended that school. And, this is one of those hard cases. We make the case for incest, we make the case for, abuse, whatever. But for her, it didn't fix anything. It exacerbated the problem. And I went on and got a degree in psych, and, I kept listening to her, but I didn't know what to say, and I can't say that my psych degree at that point was particularly helpful in understanding why was there such pain. Some of this is just how things sort of fall out. We moved to Milwaukee from Minneapolis, and I was offered a job here in the Catholic Diocese doing a part of the vision that the bishops had in terms of addressing the abortion issue. Taking that job, I quickly became what was called the Respect Life Director, but the bishops had called for an outreach to those whose lives had been touched by abortions because they'd heard the stories, and it spoke to me. I mean, I thought, we have what we need in terms of clergy, mental health professionals, medical professionals, others who can provide one-on-one care for someone who's hurting. We have to find out what's the real core of the wound, but once we find that out and we teach people how to help, we're good to go. And so it took me 7 years from the time, it was inspired to the time it finally happened. But it was interesting that the day it happened, I invited the press. We did a big training here. The press came, and the next day the press propelled it around the world. Now, that tells me that the recognition of the issue is enormous. And the same thing has happened when we've done 2 conferences on men and abortion. The press just picked it up and ran with it, but it's because we all know someone. So in terms of my own background, I'm married. My husband is a professor at Marquette University. We have 6 children and 3 children that I miscarried. We have 4 daughters, 3 grandchildren born, 2 expected. And so it's a pretty busy life. But
Awesome.
That's sort of in a nutshell.
Wow.
I'll say.
Thank you for that, Vicki. No, we do want to know why we get interested in these topics. Yours obviously was an emotional one right off the bat, and it seemed to be unresolved, which is why you wanted to pursue these resources. Am I right on that?
Yeah, it was also an intellectual question, too. I'm curious. I was in pre-med at one point in college and then moved to psychology. But what was going on that this was such a deep unresolved wound for her? So it was emotional, but it was also intellectual. Why was this different maybe than some other wounds? What was going on? And so those 2 pieces really came together in terms of my pursuit of the question.
Mm-hmm. Well, and this brings me to my next question about when women are pressured into having an abortion by family and friends. The woman goes through a wide range of feelings. And can you give me some of your perspective on these challenges that the woman will go through?
Sure. I want to even back up just a little, and for us to recognize that the woman, many times she's young, she's under 25. The brain research on children and young adults is pretty spectacular, and we don't talk about it. From age 11 to 19, that brain is rewiring itself, all right? Especially the prefrontal cortex, the higher functioning part, it's sort of on short circuit. We lose the ability to read faces accurately. I mean, there's just many changes. And one of the things is that if I'm fearful, I quickly move to the fear center of my brain. So I'm operating out of the amygdala. We've got two drives, self-preservation, species preservation. I'm now in self-preservation. I have to get rid of the problem. And especially as people begin, well, you should do this. This is the wisest thing. You have to have an abortion. It drives them further and further into that fear center. The other thing is that many people in our culture have been traumatized in utero at birth, first 3 years of life, lots of stressors. And if I'm in massive stress a lot, the part of my brain that doesn't even come online when it's supposed to, and it doesn't come online predictably if I've been massively stressed, is the moral center, the place where I process things, in this ability to look at them from a different perspective. If I have no moral ability here, it's very difficult for me to make a decision, and that's a real decision, okay, to engage the questions, to engage the experience. We also live in a society where pregnancy is a pathology, children are a problem or a possession. We've lost that gift, that concept of gift. And who is this person that will be born? Well, if I don't want them, it doesn't matter, okay? Mm-hmm. So those pieces are critical, and the fear that these women feel and the abandonment oftentimes. These young women have been told at some point, don't you ever come home pregnant. You're out of here. We'll throw you out. Or well-meaning relatives, well-meaning friends, you don't want to be pregnant now. You're in graduate school, you're in high school. An abortion's the best thing. I've had one, and it's the best thing you can do. So there are these counter forces here that don't allow her to really engage in this experience of the pregnancy. Furthermore, our young men have been told that they're sperm donors, and they have no say. I mean, it's her body. So he can't even be an advocate for the pregnancy, for the child, for her, because he's set aside. And so one of the things that's happened with abortion is we've got this enormous breakdown also in relationships, many relationships. You see how many I've talked about already here. And so this feeling that I have no one to turn to, I have no place to go, propels her forward even further into, I have to make this decision. And again, she says that language, but I've talked to the women so often, and what I hear afterwards is, once I had the abortion, it was as though I was somebody different, that my brain came back on board. And I said, how did I do that? Well, that's that being in the fear center. That's the self-preservation. It's a drive. This is not I think I could. It's a drive. And so those are the pieces, those incredible outside voices, all right, that are there. And we also have so many people who are in our society, shall I say, oops people themselves. They snuck into the family, and they're trying to prove that they're a good person, or they're one of a couple kids, and parents' expectation is that you will be perfect, by golly. You're not going to screw up. So I keep hearing
intense
all
pressure.
These expectations. It's incredible pressure, pressure.
And they're not always conscious. In fact, most of the time they're not, of where these decisions. They're not right where these come from.
No idea.
And hopefully, I don't know if we'll have a chance to get to it. It would be interesting to me to hear about. Anyways, we've got to take our first commercial break. I will find a way to articulate my question that's sitting right here in my brain. Listeners, this is Evolving the Species. Our guest is Vicki Thorne. You can go to our websites, Men and Abortion, or NOPARH.org. Thank you for being with us. Okay, listeners, we're back. This is a short segment, so we're going to move along. We're with Vicki Thorne. And she has a couple of different websites. You want to visit menandabortion.info. And then there is also NOPARH. It stands for the National Organization for Post-Abortion Reconciliation and Healing.org. Dean, why don't you just go ahead and pick it up where we left off?
Well, before I do, Lorraine, you had something you wanted to jump in with.
Yeah, it relates to actually a question you're probably going to ask later on, so I'm just going to let this proceed. Oh. Thank you.
No, that's fine. Okay, so we're talking about the part of the brain that you were mentioning, Vicki, the stress on the brains and self-preservation versus, the species preservation, if you want to think of it this way. Can you give me some insight in what takes place? I know it's a lot there, but could you do me the job of laying the foundation for me?
Well, in terms of what was taking place where?
When something like this happens, you're saying you go into fear mode, and that triggers the response, and what hormonal changes take place with the woman that you found. Yeah,
I want to be sure we cover something, Dean. I want to talk about a couple pieces of biology here at some point that are really critical to understanding all of this. But what goes on for her is she goes into this hyper stress mode. And some of these people have been so stressed that they're in a toxic stress mode anyway, which means that the cortisol is off the chart. If the cortisol in our body, which is a stress hormone, but interestingly at lower levels, it's a bonding hormone. Okay, if it's running rampant, I can't get to my oxytocin. And my oxytocin is my bonding chemistry. It connects me to my sexual partners, to my family. We women get oxytocin by being with other women, which actually helps to lower our stress. We don't even have to touch each other. Normally, oxytocin for men and women is about, skin touch. Okay, it takes 20 seconds of touch to trigger oxytocin in someone. So if we lay a hand on a shoulder or a hand on an arm, we're releasing good chemistry, this chemistry of connection. Well, the more frightened I become, the more impossible it is for the oxytocin in my body to be active. And that's one of the major pieces. And then, of course, you get into, depression and some other things. But I find that this cortisol-oxytocin piece is a really critical one in terms of many, many things that go on, in terms of bonding, in terms of parenting, in terms of relationships. And that's one of the big ones. The more frightened I become, the more it goes up.
And what you've just mentioned is something that's measurable, right? The chemistry, we see these changes when the emotional stress shows up. I wanted to ask Am if he could jump in for a minute. When you see stress, you've seen so many cases where the stress level, you don't have access to what would give you reasonable or way of accessing what you want out of the abortion or what you want out of the birth. Can you give me some insight into what takes place when the woman goes through this kind of situation?
Well,
go ahead, Am. I'm waiting.
Yeah, I wanted to hear from Am on that.
Yeah, no, I know.
Okay. Am?
What you do to the body affects the feelings, which are mostly subconscious patterns for people. What you do to the feelings affects the body, and you can get locked into a recycling loop. Ready or not, children grow up to where they're at least physically, biologically capable of reproduction. It does not mean they're emotionally, mentally, or spiritually prepared for the same. We talk about this show as evolving the species. In other words, what level of consciousness is predominant, is organizing, and is operating? As I said, for most people, it's the subconscious factor. Now, when a woman becomes pregnant, her body suddenly is flooded with hormones that prepare her to receive. They change her disposition. If she miscarries, then the body recognizes its inability and it will start to withdraw, shut down, and try to regenerate. But if you're in full physical bloom and you suddenly terminate, you interrupt that process, then the body is stuttering. It doesn't recognize it on a purely physical level. You have to have a sense of directing the body, which, depending upon the age and the development, the psychological and development of the woman involved, that's questionable. Now, when you have fear, you have a person who had sex, and everybody is somewhat educated. They know that you can get pregnant. But
right. And we have to, we're going to break. I don't want listeners to miss what you're saying, okay? So I'm sorry, it's a short segment. Listeners, we're here discussing the topic of the biochemistry, the biology, the bonding, not only, related to abortion, but what happens to men and women throughout this process. Work's a bit unique in that Vicki has researched extensively men and abortion, not just women. All right, listeners, we are back. This is Uncommon Awareness's twice a month roundtable called Evolving the Species. And before we put Ann back on, because Ann was interrupted by the commercial break, and Vicki, you don't have to answer this now. I was reading your articles, and there was a term, I believe it was chimerism. Is that correct? I wish I had
Yep.
copied it. Okay.
Yep.
I do.
That's one of the things I want to talk about. So
Excellent, because I have this particular fascination with the research being done on DNA. So sorry, guys, I had to throw that out there. So let's just remember that we need to discuss that particular area of science. Anne, please pick up where you left off.
Oh, thank you, Lorraine. All right. First of all, there's a necessity here depending on how long it's been or how recent the abortion has taken place, to try to rebalance the body, bring it back into an alignment, to calm it down, and to give it what it needs to regenerate. But the body responds to the feelings, and pregnancy, motherhood, parenting, this is, as Vicki pointed out, one of the aspects, this is a biological survival mechanism. It's tied in directly to the unconscious genetic structuring, which deals with continuing our species, keeping it going. And it brings up from that an archetype. We can come up with all kinds of emotional and mental images of parenting, being a mother, giving birth. This is a powerful image, and this is something that for most people remains subconscious. They may try to reconcile it by intellectual ideas. Well, it was necessary at the time. That's rationalization between what you think and how you are patterned or conditioned into responding. It doesn't resolve anything. The process of making a person whole is a process of them becoming conscious. All healing involves becoming conscious. You have an infection, you have to be conscious of bacteria, what can happen, and how to treat it. If you have a psychological block, an emotional block caused by deep-seated trauma to the body, then you have to also become conscious of that, not rationalize it. Of course, you want to soothe it, you want to gentle it out. What Vicki was pointing out is true. You do get all kinds of hormonal flows, but most of those are a result of the feeling body subconsciously censoring you, because these are the patterns we've inherited. Not particularly in keeping with what's needed today, but they haven't been reconciled for most people.
Thank you very much, Am. Did you want to complete that thought on your end, Vicki, or do you want to add to that before I go on?
yeah, you know what Am's talking about is really crucial, and one of the things that I find in our society that exacerbates the problem, perhaps is the best way to put it, is that we have made birth a pathology. You know, it requires intervention, it requires treatment. We don't often talk about care. It's a different thing. And I find I do many things with young adults, and when I talk about the birthing films that they were showing in class, the young men turn very pale, and they will come up to me and say, Mrs. Thorne, have you seen that film? That's awful. I could never ask a woman to give birth. Now, the girls have seen it too, and this came to mind as Ann was talking, this question of the hidden pieces, you know, in our psyche. The women are also terrified. And, you know, it's painful, it's awful. Nobody talks about the gift of natural childbirth. And there's a video I saw many years ago from Latin America called Birth in a Squatting Position. I'm trained as a doula, among some other things, as a birth companion. But I was so taken with this. It's 5 women in Latin America giving birth, and the nice doctor went down there to teach them how to do it the American way and, you know, discovered that they knew how. And it is the most profound. It's a 10-minute video, and I show it to young women, and they're spellbound. And they go, but that seems so natural. You know, they say to me, everybody dies in childbirth. Do they? How'd you get here? You know, the world's continued a long time if everybody died in childbirth. But they didn't take the baby away from the mother because you watched bonding begin. And it's an opportunity to teach them. But my experience is that hidden voice in the back of their head about how bad birth is. And parents, traumatized women talk about birth being, oh my God, it was so bad. Women who give birth and don't have those crises don't talk about it because they're not traumatized. And, when I meet a woman with good birth experience, I say, talk about it, tell people we need to hear it. So that's my initial reaction to what Am had to say.
Yeah, I back in on that point just for a second. You brought up something very interesting. If you're dealing with people that live a more natural existence, And the intellectual stimulus that we have in society, mass media, mass transportation, constant assault on the mind of possibilities, isn't there, then you're closer to the natural functions. You see yourself as part of a tribe or a community. This is a natural process. You adhere to it. When you start to develop the intellect, well, I could be this, or maybe I won't get to be that, and you start to produce emotions, which are triggering, regurgitating feelings to support those emotions, to support the thoughts, which are in contradiction. You're not sure which way is up. Then you start to separate from the body, and it can put more stress on the body. In other words, you're no longer part of the community, and you're no longer just giving birth. You have decisions to make. Where does this fit into your life? That will affect the way the body can respond to this birthing process. And most people don't know who they are or where they are in relation to that in our very modern society.
Yeah, I just wanted to interject too. Yeah, I trained as a family practitioner. I trained in obstetrics and gynecology, and I did participate in many, many births. And I can tell you, well, everyone's aware that I left the practice of medicine. The birth experience in a hospital is very dehumanizing. It has improved where baby is now placed on mother's chest. It's not whisked away, and I just say, do not let them take that baby out of that room and give them that Hep B vaccine. Don't do it.
That's right.
But it's part and parcel of this. What I think of medicine really as a parasitic entity upon humankind at this point in time. I just want to make that point. I'm just going to give you one experience of a young girl that was giving birth. This was in, an inner city hospital. We were part of Boston City Hospital at the time training. She was terrified, and I wanted to stay in her room to hold her hand to help her through it because I wasn't sure what was going to happen to her, right? And the solution proposed by the hospital was just, basically, let's put her under and give her a C-section, we don't know how to deal with this trauma. And I was actually told by my attending physician that my behavior was inappropriate. I was just basically wanted to sidle up to her and be her mom. I had never seen anyone so frightened. And, so the entire hospital experience is very dehumanizing. It does not recognize very, very intuitively, naturally, foundational, emotional experiences. Even one, like you say, one woman to another victim. I just wanted to bring that up. I wanted to give a little personal experience about the hospital setting. Thank you.
Lorraine, go ahead,
critical
Vicki.
stuff. And it's critical stuff. We women need women with us in birth. That's the concept of the doula. In other cultures, primitive cultures, if you want to call them that, but those are cultures that worked as communities, women were surrounded by women during birth. It gave them oxytocin, which enhanced the birth, calmed them down. Little girls, not little girls, but young girls saw that birth worked, and you got to be part of more and more as you matured. By the time you gave birth, you knew it worked. That's different than our society where birth is hidden. You're in the hospital. Again, we get the sort of treatment you're talking about, Lorraine, this sort of dehumanizing, instead of being present to her, holding her hand, calming her down, we'll just do a C-section, we'll just take care of this. That birth is intervention rather than process it happens all the time in our contemporary culture.
Right, it's been co-opted. It's been co-opted from women and families, and I'm so delighted to see that that doulas and midwives and all these other live home births, water births, all these other things are taking place today.
Yeah.
Then Vicki, if you could, what do you make of those people that don't that go through who've had this experience of an abortion and yet seem to have been moved without displaying any of these negative symptoms? Do you see that?
Yeah, I do see that. And, my observation is this from 30 years of doing this work. People who provide abortions will acknowledge that 1 to 10% of women will have severe psychiatric aftermath. Now, that's a diagnosis and treatment. I think that there's another 1 to 10% on the other end who would say they're fine. They're oftentimes in denial. These are people who have enormous emotional wounds. this abortion worked for them and they can keep this together. But I will also say to you that I've seen women first deal with this when they're old, when they're dying. There is the chemistry of what's going on here, and I think as we do the next segment, I'd like to talk about the chemistry of the cells in the mother and the man, how they're changed. But this whole experience of keeping it under wraps, because if I confront it, it opens all those other wounds that Ann was talking about. I've got many, many wounds. I may be spiritually aborted myself. So I have to keep it together in order to keep myself in a position where I think I'm still organized, I'm still functioning. And this question, I believe any woman who's ever had an abortion at some point in her life has to confront her biological parenting history. It's part of who we are as women. It's part of how we process things. And when we do that, this is one of the issues that will come up.
I could throw in something, and it would probably need further explanation. I developed decades ago something I call the process. It's a multi-tiered way of freeing up the psyche. But the first 3 steps are deconditioning, to break the grip of the subconscious, bring your feelings, make them adaptive under your conscious control instead of turned against you by the way they were originally set. The first session I developed deals with the relation to the mother, the sleep state, the dream state. It deals with the prenatal experience when you're in the womb and after you've been born. Because most people I have found from decades of working with women, well, working with everybody, men have this too, I could get into that, the birthing process was never completed. Even if it wasn't a hardship, there's something missing in the relationship. The body is registering feelings. Most people don't realize it. I've had people tell me, no, my mother was wonderful, I loved her, we were so close. But that's how they think about it, and that's beautiful. But when it comes to how they actually feel, that's not the case at all. And it's deeply layered in the body. It can, by the way, be easily reconciled permanently. But this is something that most people, just about everybody, is carrying around with them right.
Oh, boy, there we go again. This is moving along very, very quickly, isn't it? Well, everyone's forewarned, yeah. No, we're taking our last break for the first hour segment. The next segment will be short, and then we have to take that top of the hour break. Listeners, this is Evolving the Species with my co-host Dean Lloyd, Am Rosen, and our guest Vicki Thorne. We'll be back in just a few moments. Thanks for being with us. Okay, we're back. And we're just going to move right along. This is Evolving the Species, and we left off with, Dean? Who did we leave off with?
No, Am was completing the thought.
Okay.
Please, Am, could you come back to this?
Well, yes, but what I was saying is that, parenting, motherhood, these are things that we all had to go through it at some point. And what I've found is that most people, that's an unresolved issue. Even if their parents later on, they have wonderful relations with them. Most people feel, even if they don't think that way, that something is missing, something unresolved. When a woman becomes pregnant, a young woman, all these things resurface. She's actually cueing into her own experiences, not what she's consciously aware of. This is not a conscious process. For most people, this remains subconscious, which means you have responses to these things, which you don't understand how they got there or what's going on. But these responses control you. So you get locked into a battle inside between how you think things should be, and the validity of your thoughts is always questionable. Are they really appropriate, adequate, and effective to what your needs are? And how you irrationally feel about things, how you've learned to respond. And you get into a self-censoring mechanism. If you are looking to see yourself as a good person, but and this thing of giving birth is very powerful. It's part of the life experience, but it didn't suit you. It didn't fit into what you're doing. And even if it was, God forbid, but maybe you were raped. Maybe somebody did something horrible to you. Maybe this really could be something that could harm you. Even if you can see the validity of it on a mental level, it doesn't mean that you feel that way. The body is online, and when it's out, most people do not know how to reconcile it. I can tell you it can be easily and completely reconciled, but most people aren't doing that yet.
Yeah, and we offer solutions on this show and find, a common, even with practitioners and doctors that are not prepared to take on these emotional traumas too, that the women and men go through this experience. And leading into that, forgiveness to lead into healing, I was going to bring Vicki in on this. Are your classes on that piece of forgiveness in this healing process?
Yeah, really, and I wouldn't call them classes because I do seminars mostly with professionals. But it's about, the process is about forgiveness. It's about forgiving others. It is about reconciliation, which includes forgiveness, and reconciling with your child, with your deity, with God, and with yourself. And forgiveness is part of all of those, three of them rebuilding relationships. The first stage of forgiveness and forgiving others, the relationships may be too toxic to really be able to reconcile them. But this ability to name my pain, to take it out, to surrender it, okay, and now to make a conscious decision to hope good for that person really helps to set people free. And it's very much part of this, and as Ann was talking, the wounds that we incur in utero, how we were conceived. Were we conceived in love? Were we conceived in rape? Were we conceived in, we're just going to have sex kind of thing? That makes a difference because we carry those remembrances in our body. What happened when my parents discovered I was there? Were they delighted? Were they shocked? Were they appalled? We carry that because the chemistry changes. We also carry chemistry, the whole the area of epigenetics in terms of impact of stressors and other things that change how our genes are turned on and off. They don't change the genes, but they change what comes forward. Those are initial and important. Grandma was in enormous stress with Mom. Well, all the ovum that Mom would ever have were already present at 20 weeks in utero. It changes things. And now we're seeing that there are epigenetic changes in sperm caused by these same sort of stressors and other things. So these things are coming together in terms of in utero life. And as Ann was saying, how was I born? If I was given drugs, I remember that. It changes my body. Those are all critical things.
Great.
Okay. Well, we have to take a top of the hour break. There's about 9 minutes before we start again at 6 past the hour. Listeners, this is Uncommon Awareness in our twice-a-month forum called Evolving the Species, our roundtable. And you can go to my website and click About to find out about Am and Dean. And Vicki's website is menandabortion.info and also noparh.org. She's the founder of the Rachel Project, and we're going to be with her again in the second hour to continue our conversation. Thanks so much for being with us. See you in just a few. Again, the program is Uncommon Awareness. This is the second hour of our daily Monday through Friday programming. I'm your usual host, Lorraine Hurley, www.drhurley.net. With Evolving the Species, our twice-a-month roundtable, the second and Friday of every month, are with me Dean Lloyd and Am Rosen, and you can learn more about them by visiting Accutone.com. That's Dean Lloyd, and lifegame.com. That's Am Rosen. Our guest today is Vicki Thorne, and she is the founder of Project Rachel and the executive director of NOPARH, National Organization for Post-Abortion Reconciliation and Healing. And, she's presenting us with some really amazing and very progressive and largely unknown science around the relationships, both at mothers and children, women and men, men and children. If you've missed any part of this broadcast, I encourage you, please, to get the archive. It's really necessary that we understand this particular topic because there's a lot of people that really need help understanding what happens to them following abortion, understanding how we can support one another through these things. And I've talked enough. I'm going to hand this back over to our amazing Dean Lloyd.
Thank you, Lorraine. I respect your work and how this shows something positive that you're bringing forth with science and the stories too, and how other cultures view the birthing process. We haven't really gone into that much, but how are you dealing with women who are not clear or faltering on how they need to proceed?
Well, for me, I'm not often in that position. I am sometimes, but it really is to offer them support, that someone will walk with them. I mean, I'll never forget an experience I had when I first started my office of a young woman who called me first time when she was 16. She'd had an abortion. She was struggling. I became a mentor by phone, and she spoke to me a lot. And she got pregnant again later, not married, carried her son to term, didn't tell anyone that she was pregnant until an aunt discovered it at a wedding, looked at her and said, "Are you pregnant?" And after the baby boy was born, I said to her, "I have to tell you how much I respect you, that you did this really alone." And she said, "I didn't do it alone. You were there for me the whole way." Now, that's not about me, but it's about what it takes for somebody to be able to say yes to life, okay? This young woman's life was not easy, okay? She had a lot of trauma in there. But this somebody who cares enough to support, to be able to talk, I think, about the wonders of birth, about how mothers carry cells of their children the rest of their lives. This is that chimerism thing that Lorraine raised, and we can talk about this in a minute. I'm changed forever by that pregnancy, regardless of the outcome, whether I have an abortion or not. This remains with me. To be able to speak to the gift. We don't know who this person is that I'm carrying. Children, the fact that anybody ever gets pregnant is a miracle beyond belief, because there are so many things that can go wrong from the get-go. All right, there can just be things that just don't work right. So in the plan of the world, there's meaning in this life. Maybe this life needs, maybe she'll place this child for adoption. There are millions of people waiting. I don't know if you guys saw the story of the woman with the Downs baby. I think maybe it was North Carolina, Virginia. She spoke to her priest. She was considering an abortion. He said, "Please don't, I'll find a family." Put it out on social media. In 1 week, he had 900 families willing to take this baby and love it. That's how the human race works best, okay, when we're given that opportunity. But it was really about giving her the kind of love and support, listening, somebody believing enough in her that she can do it. That was what happened with this young woman. I believe she could do this. And that gave her the resource, the internal resource, to be able to do it. So those are the pieces. And then also, I do a lot of speaking to young adults and teenagers on the biochemistry part, which we haven't really talked about today. If I can help them to understand that our body, we are embodied people, not disembodied people, and that this whole chemistry, this whole ability to create new life is gift, and help them to see that in a different light, I'm also helping them. And I've had women say that to me, that changed their life, and guys too. Guys really like that.
But do you do anything then to assist the rebalancing and stabilizing of their?
No, I am not. I don't do that kind of work. I'm familiar, though. I will tell you, one of the things I recommend is that chair massage, the work of Tiffany Fields at the Touch Institute down in Miami, in terms of charting hormones and seeing results, is amazing. And one of the things that I really encourage those who work with these women to do is to find a way to provide them just with something as simple as chair massage. 3 chair massages a week calms cortisol, releases oxytocin. That's where we need this pregnant woman to be in order to make a decision for life. She needs to be in the oxytocin mode to be in the species preservation. And this is, that all makes it sort of sound distant. But the reality is I have to be aware that this is my baby, and it's, my body, and to be connected to the embodied part of me rather than the self-preservation, which in some respects is disembodied. I'm shut down. My body is not working the way it should be because of all the stressors. So that's one piece that I talk about a lot.
I'm glad you do, because it's an awareness piece, and the nurturing you mentioned, like with chair massage, we all have to relate to this. And I wanted to bring in, because we talked in the first hour, touched on the forgiveness piece and how that fits in here. Could you give us how does forgiveness work? What define it for us and tell us how, when you go into, am I forgiving myself? Is everybody around me, are they forgiving me? Tell me what it is.
Well, yes, what part of you is forgiving what part of you? In other words, you're stressed, you feel afraid, you have anxiety, you're confused, you're doubtful, and you feel like you've done something wrong. You're essentially dealing with guilt, and guilt is self-internalized disqualification. You've internalized, accepted a limit on what you have the right to think. Now, if you're evolved, you can use reason and logic and see whether your thoughts are valid. But more insidiously, you have a limit on what you have a right to feel. You've been locked into a conditioned program response, which quite often goes against your reason, your desire, your better judgment. But the feelings will, no matter what you think or avoid thinking, everything you feel affects the physiology, creates tissue disposition, goes through the visceral organs. That's why we talk about gut emotions. So you're looking for a way to leverage yourself away from the negative. The problem is you're either going to avoid something, you're going to try and compensate and settle, well, okay, this is okay. I like to call forgiveness reowning the circuitry. There's only one of you inside there. But some of the circuits, some of the ways you respond to things were arrested before your intellect was online, before you could screen, question, challenge. We're all born dependent, ignorant, helpless. If someone doesn't pick you up, feed you, take care of you, you die. And we don't have any way of screening. When you're 1 or 2, you don't say, hey, Mom, Dad, all this stuff, it's interesting, but can you give me some second opinion, some scientific proof? You're taking it in on a deep, automatic response level. Later, when your intellect develops, you say, well, wait a minute, I'm me, and I'd rather do this, and I like that better. That's when the war starts between how you think and how you feel. So part of the forgiveness, the real part of forgiveness is reowning the circuitry. It's getting access to where those responses were locked in, from the deepest recesses all the way up to the present, and making them malleable. If there's something good there, you want to keep it. You may need to refurbish it. You may need to discard it. But starting to unify the whole nervous system so you can pick and choose, which would also bring us to the problem of modern society. It's a problem of individualizing. Now, men and women for a long time were locked into battling modes. Men, out of fear, avoided their feelings. That's why they tended to overly structure things intellectually. It was a form of avoidance. Women were more adjoint with their feelings, more open to them, more used to them, their responses, but that doesn't mean they understood them. The answer is not the man or the woman. In terms of creating a safe place to explore whatever the biogender equipment and the psychological repercussions of that happens to be, the answer is the individual. 2 + 2 = 4. That is not gender specific. But it's only recently, with our technological development, that long overdue that women have finally started to come into their own in terms of education and access. But we're all carrying a lot of patterns that come from the tribal orientation of our earliest days. And the nervous system is sophisticating. We should, a man and a woman should be able to enjoy and indulge in the birthing process, but as Vicki pointed out, there's the self-preservation. We want to go from self-preservation to self-fulfillment, self-actualization, and there's a big difference. In all considerations of health, physical, emotional, mental, or social, you have 2 approaches. The one most people are fixated on is we've got a problem, let's get away from it. Absolutely. Comfort, trying to find some way to ameliorate, regain balance, if you were in balance. But the other aspect, which is much more interesting and much more in keeping with what we need right now, is how can we enhance? How can we upgrade? How much vitality, mental clarity, stamina can we bring in? How much access, control, not avoidance, not escape, not denial, but being able to access all of the circuitry at will, mix and match it to your heart's content, or leave it there and be aware that it's there for you to use when you want to. This is something new that would allow parents, they would influence children. Children pick up on the cueing signals of their parents, and this has been passed on generation to generation. But with what's accessible to us now, it's outmoded, and it's actually becoming detrimental.
Excellent. And I wanted to bring Lorraine in here for a minute because it's about resources of getting access. And I wanted to ask you, Lorraine, if you can relate to being frustrated in how our society and medical institutions that didn't prepare us or you for the pre- and post-abortion and giving birth, too. And what are you realizing now about how this ties into the relationship with our mother? And can you answer that when you come back?
Yeah, you might have to review it. That's a very long question. I'm happy to answer that. We have to take our first break of the second hour. Listeners, this is called Evolving the Species. We're talking about post-abortion healing, but also relationship between men and women, men and children, the birthing process, so much. And I only regret that we're not going to get through everything I'm interested in talking about. We'll see you in just a few moments. Okay, listeners, we're back. The ball's in my court. I've been asked a question, and I've been sitting here thinking about it during the break because I don't want to take up it's a loaded question, Dean, and I think what you're asking me to do is express my frustration with my training, but I have a personal story, and I'll be very quick to relate it. We didn't learn anything about abortion, about post-abortion trauma. We didn't learn anything. Just like my biggest frustration with my profession was not what I learned, it's what I didn't learn. I felt a huge betrayal. And I'll just share with you, I got pregnant after many years of effort. My daughter is treasured to this day. And I got pregnant in the last year of medical school, and I delivered in my internship year. And nothing could have prepared me for the love and the attachment I felt to my daughter. It put me immediately at odds with what my chosen career path. And here's my personal experience, and I will get to the point. My personal experience was that once my daughter was born, nothing else mattered. It was so I took 3 months off, and I had to go back, or take a year off. And of course, this is such a grueling undertaking, and I began feeling the dehumanizing aspects of medical training very early on. I was an older medical student. My daughter was born when I was 39. And I struggled. I would do things like, it was 45 minutes away from the hospital. If I would bring my daughter to conferences. I would do anything it took to be with her. My husband took a job sharing. So immediately there was this huge conflict. And basically the people around me were saying, you've worked so hard, you can have everything, you can be anything, you can do it all. And I came to the realization you can do it all, maybe just not all at the same time. So there's this having to leave this child that I deeply desired and did welcome because I didn't do any prenatal testing, didn't know what sex it didn't matter. I was going to carry this child, and perfect or imperfect didn't matter. And she was more than welcome. It just blew my mind, the experience of actually holding this infant every day and nursing her and loving her. And so what happened is that my profession, both professionally and personally, was such a conflict with the entire experience of motherhood. I learned very quickly that as a professional being in training, they own you. They own you, and they can make your life miserable if you don't toe the line, if you don't keep yourself in competition. And the whole medical school in general, whether we're talking about birth or we're talking about treatment or we're talking about the ICU, it doesn't matter, has been degraded into a very mechanistic, and as I said before, it's a very dehumanizing process. Physicians today are largely, and I have great respect, Dean, for a number of practitioners. I'm not saying everybody, I'm saying the system really creates technocrats, people that are not encouraged to think critically or outside the box. So my frustration early on, as I mentioned in medical school, this young woman that I told you about earlier, was actually very early in my training. And I was basically, indoctrinated right then and there that day. We don't get personally involved with our patients. We don't hold their hands. We don't put our arms around them. we don't do anything to suggest, that we actually feel their pain.
Yeah.
So there was conflicts early on, and I wouldn't be where I am today. In other words, I'm one of those people, Vicki, that we talked a little bit about social engineering. I was so conflicted, so emotionally traumatized, so I had so little access to my own feelings, as Anne will say. It was very little access, that I did what was expected of me, and I was a seething cauldron. And when I left medical practice proper only 2 years after finishing residency. I homeschooled my daughter. I don't want to go into too much of the story, but it's only been recently, work like this is why I so respect your work. It's only been, actually meeting you has helped me to understand, in hindsight, some of what I was going through. Mm-hmm. And I've shared, and I had an abortion at 19 years of age, and I debated whether or not to say that. I just want listeners to know that we're talking about this because I can relate to everything that's being spoken about. And, it's, as Anne would say, guilt it's not a self-serving emotion. What we have to do is simply grow up enough to really begin to accept the truth of our feelings, our realities, and begin to work towards a more sane, a more loving way of dealing with life. And a lot of this is put upon us by the outside. So we just have to kind of stand strong and say, you know what, I don't care what the outside tells me. I don't feel right. I don't believe this. And figure out, how to go about actually becoming whole or integrated again. Dean, did that answer your question?
It did, and it was eloquently put. Thank you. I appreciate your allowing us that insight because, Vicki is talking about things that she's experienced and seen how these problems are deep. And when we come back, I'll be talking about symptom-based attitudes and how we can change our perspective and make this a healing situation.
Very good. Listeners, we'll be right back in just a few moments. Thank you for being with us. Okay, listeners, we're back again. And we're continuing our dialogue with Vicki Thorne and Ann Rosen and Dean Lloyd and myself, your host, Lorraine Hurley. All right, Dean.
Thank you. Before I bring Am in, I'd like to talk to Vicki about what you've seen with your experiences of the symptom-based attitudes in abortion and how incomplete birth effects and the outlook, on the life of both men and women on that.
The first thing I want to say is that we have to keep in mind that a woman who's had an abortion is always a mother who's lost her child in a traumatic and unnatural fashion. There are cells that remain in the mother's body. They are present by 4 weeks after conception, so before we even confirm a pregnancy, that can be found. And these are cells of the children. So it is biologically impossible for this mother to forget that this child existed. It's there, it's present in her body. They appear to last throughout her lifetime. She also passes those cells on to other children who would follow. So there's also biological knowledge there that someone is missing in the system. For these women, the anxiety that comes having made this choice oftentimes, again, changes the chemistry of her body. Women oftentimes turn to alcohol, to drugs, cutting, some of those very dysfunctional, damaging behaviors in an attempt to either numb the pain or to feel some kind of pain. She may attempt to get pregnant again. 78% of women, especially teens, get pregnant within 2 years after an abortion, which may result in another abortion because nothing changed. All right, the biology's running the ship here, and the brain isn't necessarily engaged. Nothing changed in terms of the internal dynamic of her fear. So those are important pieces for us to understand that the biology, and there's still so much we don't know about what's going on internally. The issue of abortion is politically incorrect. We don't want to talk about aftermath. Some of the most significant research has been done in other countries in terms of, suicidality, in terms of now putting her at real risk to have a premature baby. If I've had 3 abortions, that increases my chance of prematurity by 270%. it's a done deal. All right, and now we have more conflict, we have more concern, we have more risk. And so there are these many, many pieces there. And again, I think that this memory of how I was born, we in my mother's generation, from really the 40s on, women were given high-test estrogens that changed their bodies of their children. And so now 3 generations later, we know there are still biological outcomes from this thing called diethylstilbestrol, both in males in terms of fertility, genitalia malformation, and the same is true in women. Bifurcated uteruses, fertility issues, a strange ovarian cyst issue that's coming up in the 20s and 30s. It's not polycystic ovaries. So there's all these influences. Women were given major drugs. Birthing mothers were given morphine. Their babies got morphine. They were given another hallucinogenic drug. Their babies got that. In Scandinavia, there's a man by the name of Bertil Jacobson who looked at families, 3, 4 babies, who got drugs, through mom at birth. And those were the kids who were drug users. All right? So what does this mean in terms of how I'm born, the pain I might feel from forceps delivery? If I'm a C-section baby, I didn't trigger that labor many times, and so I miss the chemistry that prepares me for the world and leaves me traumatized. So there are just all these pieces, and again, so much we don't know yet, Dean.
No, and thank you for clarifying. It also reminds us how when we're connected, when we are really connected to the mother, that true nurturing, that part I wanted Am to elaborate on a bit. Can you give me that, when you have seen the patients that have come to you that haven't completed their process of being nurtured, what does it look like to bring that up and heal?
Can I just interject? I'm sorry, I'm going to interject one thing just for the sake of listeners. I want them to know I've been researching DNA and the lineage and really how do we acquire mostly what we call junk DNA. We've got 5% or less is coding. And what Vicki's talking about in terms of cells remaining, there's actually now really clear documented evidence that we are, in fact, we retain, just like we retain what we eat, we retain genetic material from microbes in the environment, whether harmful or beneficial, and we do actually have this extraordinary lineage, what mystics might call the Akashic records. We're now showing scientifically is absolutely true. We have imprints from every parent, from our entire lineage, And
yes, some of that work is Brian Sykes, if our listeners are interested, the 7 daughters of Eve and Adam's curse, in terms of just the mitochondrial DNA that we all carry back to 7 lines of women, with the implication there was some sort of Eve figure, and you guys carry that plus your father's Y, again, back generations and generations, and so these things are present and bring with them, as you're saying, this sort of memory.
Right. I'm sorry, Am. I wanted to clarify that.
No,
it's just fascinating.
Thank you. It's very helpful. What people call junk DNA, I think they haven't identified. I mean, they're just at the beginning of this. It would be better to be more facilitating to say activated DNA or dormant DNA. There is no junk. Right. But as the nervous system evolves, in other words, if you are close to the physiology, you are living a primitive or a pastoral existence where you're rotating with the seasons, there's not a lot of technology, then the body responds in a certain way and your consciousness flows with it. When you start to augment and accelerate it through the cultural artifacts we have, through our intellectual development of ideas, it changes the shift on the way the body processes. Emotions focus in through the tissues, and most people keep recycling the same problems. As you go up the ladder, as you clear that out, then the use of the organs and the activation of the DNA comes more fully online. It really depends on how you're using the body. But most people don't have control of it. I mentioned before that I developed the process, and the first step, which deals with the pre- and postnatal experience, the object there is to get you to feel, not just think that you should feel. People think they should feel all kinds of things, but you're reuniting the body. You're reintegrating the feelings with your adult conscious mind to get you to feel that you are loved and deserving, and that you love being born in this world. Now, most people find the world to be a hostile enemy that they have to hold themselves against because that birthing process wasn't completed. Just quickly to mention, these were 3 steps. They're non-regressive that I found were absolutely necessary to free up the psyche on the subconscious level. Second step is to get rid of fear. That dark sense of dread in the back of the mind, you might call it the archetypal boogeyman, whatever makes you inadvertently sabotage yourself or do a trade-off, where if you seem to become competent or excellent in one aspect of your life, you feel compelled to mess up in another, which of course keeps you from fully accessing your competency. So that whatever is available to you, your education, your social connections, your sexuality, you feel that you can utilize it to your heart's content. Of course, it's a question of how skillful you are at that utilization. The third, the last of what I call the deconditioning sessions, deals with the relation to the father. It deals with power. It is to break the grip of the patriarchy so that you come to, again, feel, not just think that you should feel, that you have your own power, that you don't have to go through someone else or a system to access it. It's nice to be with someone because you want to be. You see the opportunity to combine energies and do something beautiful. It's lousy to be there out of compulsion, even if you're the more capable person. With men, it's to get them to stop feeling afraid of women. With women, it's to get them to stop resenting men. And with everybody, whether they want to capitalize on it, use it, or indulge or not, it's to get them to feel intrinsically beautiful about their sexuality, which is the big elephant in the room of everything that we're talking about. The reproductive force, as we go up the scale of evolution, as we become more conscious, takes on different forms. But most people are still operating from the compulsions. Nothing wrong about them, nothing right about them. They're just aspects of our psyche, but we're no longer just operating through the unconsciousness or the subconsciousness of the body. And all of this needs to be integrated in order for people to feel comfortable in whatever lifestyle choices they make.
That is beautiful, Am. Thank you. You said father, and I wanted to bring father into the equation here, Vicki. I know you've got some things to tell us about that. Please do.
Yeah, we don't realize that how deeply men are involved in the dance. When a woman is pregnant by pheromones, which are scent molecules of affiliation, the male recognizes this. And about the same time she gets the cells that are, present in her body, he's having a hormonal change. His cortisol goes up. It makes him more protective. 60 to 90% of men will have symptoms with their partner. It's called KUVAD. 20% of them are really sick. Those fathers, interestingly, when the baby's born, is hardwired to know the differences in the baby's cry. And then 6 weeks before the baby comes, his hormones change. His testosterone drops, his estrogen goes up, more cortisol, vasopressin, which is about bonding and, sort of staying put. And he gets, right before the baby comes, prolactin, which is the nursing hormone. It makes him kinder, more protective. And with every subsequent baby, he gets more prolactin. When the hormones begin to go back to normal, his testosterone never goes as high again as it was when he was the bachelor hunter sort of guy. Now he's the provider protector. He still has adequate testosterone, but he's physiologically changed. And in the primate kingdom where the males care for the young, one of the things that's interesting is they get new brain cells in the prefrontal cortex, the higher functioning part of the brain, and they last until the young become independent. Nobody's done that research on men. There's some people talking about brain change now, but nobody's done that. We're designed to be together, and for men to assume this new place, this new responsibility, just as mothers are being changed, and mothers are being protected every time she nurses a baby and weans it, because that's the end of pregnancy, not birth. She gets a 7% protection against breast cancer. Breast milk has been identified now as having two substances in it that kill cancer on contact. 40 kinds in a Petri dish. I mean, this is so amazing in terms of how our body functions.
Absolutely. Okay, boy, these breaks come up very, very quickly. Listeners, we have to take one more break, and then, guys, we'll have to kind of figure out how to wind down this program. It's been so spectacular. A lot of things we actually didn't get to, and maybe we can do this again. We'll be right back, listeners. Thanks for being with us. Okay, listeners, we are back, and we're winding down today's Uncommon Awareness show. It's our twice-monthly roundtable, Evolving the Species. And Dean, why don't you wrap us up?
Thank you, Lorraine. A lot of what has been brought up here is about fear. What I wanted to do is get some closing statements from both Am and Vicki on this, and where do you see it going? So, Vicki, would you start, please?
Well, I think, this question of making people understand the gift of birth, how it changes our body, how it protects us, I think begins to chip away at that. To begin to talk about just how the process works begins to chip away at that. We must speak to the fact that children are a gift in our society. There are stories, Time Magazine and The Guardian had one yesterday on smart women not having children. They're making a decision. For the good of our society, this is a disastrous decision. We really have to speak the truth with love, not with condemnation, and help those who have had abortion losses to heal, because in that healing process, the forgiveness, as Am is talking about, is so important. They become enormous gifts to the society in terms of seeing the world in a different way. We have a very, very broken world, and we must continue to speak the truth so that we can empower people to make good choices and good decisions in terms of relationships, in terms of commitment.
Excellent. Am?
Well, yes. All fear, the parasite of fear, is dissolved by understanding. All fear, all doubt, confusion, and anxiety come from two things. One, whatever it is you're considering dealing with, you don't really understand it. You may have brilliant opinions, scientific facts, but you don't understand it yet. The other thing it comes from is you insist that you do have an understanding. You fake it. You fudge it. You come up with a point of view, and then because you want to be right and you're afraid of being wrong, you become armored, desensitized, somewhat coarse. The easiest way to get out of this trap is when you're not understanding. That is, when you're experiencing any degree of fear, doubt, confusion, or anxiety. Admit to yourself, there's something here that I don't yet understand. Now, you may have to go with what's available to you, but you'll only get into emotional difficulty when you stop seeing it as a range of motion, a possibility to be explored and experimented with, and you start saying it's right. If what I think or feel isn't an understanding yet, no matter who believes what, then what's missing? What haven't I seen yet? What else do I need to become aware of? You get off that pedestal of self-justification. You start to become open and receptive. And that's the state of mind you have to be in order to see what's going on, to finally get the understanding that will give you the control you want.
Beautiful. And Lorraine, did you have anything you wanted to add?
No, only that I completely agree. I think that what Vicki said, and both Am, what we're dealing with is a society, an engineered society, the forces of which stand to gain so much from our brokenness, our ignorance, our confusion. And, this isn't, again, it's not about us and them. It's not about blame. It's really pulling together as individuals in our communities and our families to begin to affirm and reaffirm the joy and the beauty of life, the joy and the beauty of life, and the right to life. There's so many perversions have kind of crept into our collective consciousness, and Am does an eloquent job of describing how this happens because we're not. It happens precognitively, essentially. I'm just sorry, Vicki. It'd be nice, like I say, to even have you on. We haven't even talked about pheromones, and we haven't talked about how chemical contraception really affects the man-woman relationship. We've only really touched upon, the consequences of men and abortion, and of course, women having really undergone the abortion. This focus, but I love what you say about actually when we help these women heal. myself included, many, many others that I know, we do become a contribution to society because we're thinking so much, we're involved, we're alive, we're standing in our truth. It's a beautiful thing. Gentlemen, Am and Dean, thank you so much. Vicki, thank you. Men and Abortion,
thank you.
.info listeners, and just look up Vicki Thorne. She's written some incredible articles. Am, beautiful job today, helping to get us oriented.
Privilege to be able to contribute.
Thank you. We'll be back on Monday, listeners, Uncommon Awareness at 8 a.m. Eastern Time. Thank you for being with us today. If you've missed any part of this broadcast, I encourage you to get the archive. Or in a few days, it should be up on YouTube, commercial free. Everyone have a blessed day.